Bismillahirrahmanirrahim. The second lectures which we took in fetal chest ultrasound. Congenital cystic adenomatoid malformation of the lung. Congenital cystic adenomatoid malformation of the lung, adenomatoid hamartoma. It is benign tumor of the lung characterized by disordered overgrowth of terminal bronchioles. Congenital cystic adenomatoid malformation is a rare malformation of the lung. Ultrasound features intrathoracic lung mass, abnormal cardiac position, hydramnios, and hydrops. Classification of congenital cystic adenomatoid malformation into three subtypes according to the size of the cysts. Type 3 echogenic solid mass, microscopic cyst. Type 2 has a multiple small cyst or less than 2 cm in diameter. Type 3 consists of non-cystic lesion producing a mediastinal shaft greater than 2 cm in diameter. The worst prognosis is type 3 solid echogenic mass. Cystic adenomatoid malformation of the lung, multiple lung cysts, multiple small cysts, microcysts. This is three types. Microcyst, which solid echogenic mass, the third type and the most worst. Type 1 CCAM is placed heart to right side, multiple cyst. And this is heart, spleen, multiple cyst. Multiple large cyst, as we see, and this is heart. Microcystic variety type 2 is another image. Congenital cystic adenomatoid malformation, CCAM. Congenital hamartoma lung lesion affect only one lobe. Lesion consists of multiple cysts. CCAM in type 1 in a fetus 27 weeks, transverse sonogram show multiple large anechoic cysts in the left hemithorax, multiple large anechoic cysts with juxtaposition of the heart. This heart juxtaposition to the other side. This heart is multiple cyst, large cyst, in axial T2 and the coronal T2 weighted image. Large multicystic mass with high signal intensity occupying the left hemithorax. Note the mass effect with mediastinal shaft to the right side. CCAM type 1 hybrid condition, a fetus at 31 weeks gestation. Coronal color Doppler show an enlarged and hyperechoic left lung with an echoic cyst in the upper lobe. Note the feeding vessel that arises from the aorta. Coronal axial image T2 MR show asymmetric enlarged left lung that's hyperintense relative to the right lung and large systemic vessel in the base of the left hemithorax. Findings that confirm presence of hybrid condition. Not all cyst-like lesions in the left upper lobe in coronal images. Feeding vessels. Differential diagnosis of CCAM: diaphragmatic hernia, bronchopulmonary sequestration, eventration tumor. Lung sequestration, bronchopulmonary sequestration and accessory lung. It is congenital anomaly which mass of pulmonary parenchyma separated from the normal lung. It usually do not communicate with an airway and receive its blood supply from the systemic circulation, maybe extralobar or intralobar. Lung tissue supplied by systemic artery, pulmonary sequestration. Lung tissue separated from vascular connection, two types, intralobar, adult, extralobar, which present in fetus. Extralobar. In the extralobar variety, most common, the sequestrated lung is covered by its oil visceral pleura. Ultrasound finding. homogeneous echogenic solid lung mass. Splice mediastinum Mercadal Doppler systemic blood supply demonstrated arises from the thoracic aorta. Serine anomaly without familial predisposition in the extralobar variety male to female 3 to 1. Sequestration of the lung. Echogenic solid homogeneous echogenic mass. لا apparent systemic blood supply. Extralobar in fetus. Sequestrated portion of the lung appear homogeneous brightly echogenic mass in the lower lobe of the lung on the upper abdomen. Infradiaphragmatic sequestration. The diagnosis confirmed by color Doppler demonstrates that the vascular supply of the sequestrated lobe arises from the abdominal aorta. Normal lung, hydrothorax, and this heart. Sequestrated lung, solid echogenic homogeneous mass. The pleural hydrothorax, which make lung collapse. Extralobar pulmonary sequestration with non-immune hydrops. Bright pulmonary sequestration with bilateral hydrothorax. Bright pulmonary sequestration. Bronchogenic cyst. Bronchogenic cyst is a cystic structure lined by bronchial epithelium. Incidence of the bronchogenic cysts is unknown since a large number of them are asymptomatic. They are extremely rare in neonatal period. 2 bronchogenic cysts, cystic structure lined by epithelium. Dumbbell-shaped cystic structure that extended both in the chest and in the abdomen. Bronchogenic cyst, as seen by 3D study. Bronchogenic cyst. Bronchogenic cyst of fetus 28 weeks. Transverse color Doppler sonogram show bronchogenic cyst in the left hemisthorax adjacent to the heart. Bronchogenic cyst adjacent to the heart, as in coronal axial T2, sagittal, axial, and coronal MRI T2, axial, coronal, sagittal. Hyperintense fluid field cyst within the left lung parenchyma. Chest wall. Perinatal and postnatal features of mesenchymal hamartoma of the chest wall. Lesions that arise from chest wall at 32 weeks show mass consisting of solid and cystic component with calcified border, black arrow, and a hyperechoic focus suggesting internal hemorrhage. This is mesenchymal hamartoma of the chest wall. Chest X-ray show bilateral rib abnormalities. Addition small right solid mass, much larger left-sided ones placing heart. 2-2 coronal view. CT scan of the chest show one lesion arising from the right and the multiple lesion arising from the left chest wall. Large left-sided mass contains a hemorrhagic component. Prenatal diagnosis of fetal chest lymphangioma. Axial image of the left fetal chest at that 15 weeks at the level of throat chamber view, showing symmetric mass honeycombed in appearance with multiple echo-free areas of varying size in the mass. Axial image at 22 weeks gestation showing mass connected to the chest wall. Mass connected to the chest wall. Axillary cystic hygroma. Ultrasonography show large multiple septated cystic mass in the right axilla. This mass and chest. Axillary cystic hygroma. Atresia and agenesis. Pulmonary atresia and pulmonary agenesis. Bronchial atresia. Axial color Doppler show obtained at 28 weeks show hyperechoic lesion in the lower lobe of the left lung. Hyperechoic lesion in the lower lobe of the left lung. في الأكزيال and coronal T2 image obtained at same day show lesion with a high signal intensity. Postnatal chest radiograph show no significant abnormalities. Axial chest CT and coronal MIB obtained in neonate 15-day show hypoattenuating mass of the left lower lobe with dilatation segmental bronchus inside the hypoattenuating area. Bronchial atresia. Present ultrasound fetus study as echogenic area. Echogenic area, like we remember, pulmonary sequestration also appeared as echogenic homogeneous solid mass. Agenesis of the right upper and middle lobes. Postnatal chest radiograph which show agenesis right and upper middle lobe. Postnatal CT of the chest, agenesis of the right and upper lobe. Unilateral pulmonary hypoplasia, scan at 32 weeks. Postnatal chest show right unilateral pulmonary hypoplasia. Decrease the volume in the side which show hypoplasia and shift intestinum to this side. Unilateral pulmonary hypoplasia. BAVM in a fetus at 34 weeks gestation. Color Doppler show vascular lesion in the right hemisthorax adjacent to the heart. Coronal T2 MRM show hyperintense lesion in the middle of the right lung. Hypointense lesion, hypointense, low signal in the middle of the right lung. Avascular malformation. Fetal pneumonia. Images of fetal pneumonia show in transverse varicegenital scan of the fetal chest hyperechoic appearance of fetal lung. Hyperechoic appearance of fetal lung. Image show transverse and varicegenital image with hyperechoic appearance of the fetal lung. This appearance of fetal pneumonia. Image show hypoechoic amniotic fluid. The image B show postnatal X-ray fetal chest with burst small opacities at the level of the lungs. Burst small opacities at the level of the lung. Neonatal pneumonia and appearance of fetal pneumonia called amniotic fluid, hypoechoic amniotic fluid, and placenta. The echogenic appearance of the lungs also can be operator dependent. Many pitfalls make impossible to standardize fetal lung change during gestation. In our case, the lung appeared more echogenic than the liver, with a contrast of shadow of the ribs. Bilateral hyperechoic appearance of fetal lung associated with echogenic appearance of amniotic fluid can be sign of early fetal lung inflammation due to chorioamnionitis. The differential diagnosis of sonographic appearance of bilateral echogenic lung include bilateral microcystic congenital adenomatoid malformation, Stoker type 2, type 3, Acheron type 4. It's usually associated with a fetal ascites and placentomegaly. Prognosis is poor. Airway obstruction as prenatal tracheal obstruction caused by cartilaginous pair or possibly associated maternal pertussis infection. Chickenpox during pregnancy may lead to lung hyperechogenicity. Fetal candida infection due to retained intrauterine contraceptive device. Congenital syphilis, unusual cause of bilateral pulmonary abscess, but no perinatal description weak. This is differential diagnosis sonographic appearance of bilateral echogenic lungs. Fetal lung maturity ultrasound imaging feature. It's an interesting subject. Many theories, many studies talk about fetal lung maturity, and these questions which you faces in our clinic. Obstetrician need to decide if he do early labor or not, and ask it's lung mature or not mature, and refer to you to answer this question. We depend in this slide in the liver echogenicity comparison with echogenicity of the lung, and this is easiest way. Sonograph representative classification of lung echogenicity as compared with that of the liver. Lung hypodense compared with the liver in this image. Isodense compared with the liver in this image. Slightly hyperdense in this image, definitely hyperdense. If lung hyperdense than the liver, it's mature. And this is study, and this is slides. We depend on the echogenicity of the lung. Samples of fetal echogram with lung and liver regions and region of interest, 30 weeks and 26 weeks. Compare with both sides. The ratio of fetal lung to liver feature value were investigated as possible in this history of classifying the images into those from mature, reduced pulmonary risk, and immature possible pulmonary risk. The features used as fractal dimension lacunarity features derived from histogram of the images. Comparing the frequency characteristics of the lung equal to those from the fetal liver as the reference organ. For ultrasound, other for ultrasound parameter which may be used to lung maturity. Echogenic thalamus, placental calcification grade 2 and 3, biparietal diameter above 9.2 cm, presence of amniotic fluid vernix. This may be parameters for lung maturity. Ultrasound parameter. Echogenic thalamus sensitivity, specificity, and the predictive value. Specify fetal for ultrasound parameter as our study as sign of fetal lung maturity is comparison. Placental calcification grade 2 and 3, biparietal diameter above 9.2, presence of amniotic fluid vernix. Evaluation of thalamus echogenicity by ultrasound as a marker of fetal lung maturity. Ultrasound show echogenic thalamus as 38 weeks of gestations, white arrow. Fetal pulmonary artery Doppler waveform acceleration ejection time measurement may provide an invasive means of determining fetal lung maturity with relatively acceptable levels of sensitivity, specificity, and predictive value. PATET.